Hello, 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 fellow orthodontists. Welcome to the Masterclass TED Mastery, Total Control in Orthodontics. For those who don't know me yet, I'm Professor Kleber Meireles, and I'm truly excited to connect with you today. This special webinar is the second in a series designed to warm you up and get you ready for the two powerful hands-on in-person trainings that will take place soon in Romania. Both the events crafted to elevate your biomechanics and finishing skills so you can have the highest level, can reach the highest level as possible in orthodontics. Are you curious to learn more about this unique experience in Bucharest, Romania? Hold on, because I will, in just a moment, I will explain exactly what I'm talking about. But first, we're going to the TED's mechanics, okay? Now we're going to dive into key concepts and strategies that will help you learn how to use TED to gain full control over your mechanics, cut treatment time, and achieve superior aesthetic and functional results, even in the most complex cases that you can get in your office, in your practice, okay? And before we even start, while our colleagues are joining, I'd like to check if everything is okay. From my side, everything is perfect, so please drop a comment here in the chat for me to know if everything is all right, okay? So let me see. Great, everything is great. Thank you, thank you. Okay, and look, how amazing we already have many orthodontists here with us, and you know this is a global event. So I'd love to know which country you are from or where you currently living. So please drop a comment in the chat here, and I want to see which country has the most colleagues joining us today. Okay, let me take a look. Okay, that's awesome. The United States, Poland. Welcome, guys. I've been to Poland 3 months ago. I was there 3 months ago. Hello, Philippines, Malaysia. I'm coming to Malaysia soon, next week actually. Saudi Arabia, great to have you here. Have plans to go to Saudi Arabia as well. Indonesia, have many followers from Indonesia. Sometimes I give webinars to them. Romania, we'll be in Romania, Bucharest soon with this event face to face. Australia, South Africa, good to have all of you here with us, guys. Look at this, orthodontists from all over the world. England, oh, I love England, been there 4 times. Germany, India, also many followers from India, France, and many more. Thank you very much for being with us. Your presence means a lot to me. Hope you have a good experience today with this event, okay? So let's get started. I want to speak with you about this beautiful and important topic that we have nowadays in orthodontics, which is TEDs, use of TEDs in orthodontics. Especially, I will focus today in mini implants, orthodontic mini implants, both extraovular and conventional ones, roots. And I want to tell you about some advantage that we have with absolute anchorage with mini implants. They are less invasive when we compare with mini plates, for example. They have few anatomic limitations because we can insert different areas to escape from the path of the teeth that are erupting. Easy of insertion and removal, I'm going to show to you. Allows immediate loading, as also integration in this case is not a prerequisite, and have low cost, can be used on children, great predictability of tooth movements, and we don't need our patient to be cooperative, to collaborate, because they are fixed, and we don't need patient compliance for having a good treatment. About the history of mini implants, of course, we're not going to be very thorough on this topic, but you know that there's a long story behind us. It started presumably in 1945 with Gainsford and Higley, actually, which started with this approach, trying to intrude upper anterior teeth, and they kind of managed to do that. They lost the mini implant in the process, but for a while it was stable enough to provide the intrusion of upper teeth, which is considered successful in this case. So we have pre and post. As you can see, it's a very old mini implant attempt. It was 1945, and after that we had a long history of mini implants being attempted to be inserted. We know that Kanomio was one of the first orthodontists to try to use mini implant as direct anchorage in orthodontics. So this is from 1997. And after that, many people try to use different designs. This is from the mini plates, a special screw for mini plates used as anchorage to retract lower anterior teeth. Also Memori, we have Kanomi. Many people helped us on discovering ways to use mini implants in our practice. And one thing that I'm gonna explain to you, and it has everything to do with our lecture today, is are the components of mini implants, especially the mini implant head. We have the head of the mini implant, which is technically composed by this part of the mini implant, which is outside of the gingiva, or the mucosa, the transmucosal profile or transmucosal neck. This area be here between the intraosseous portion and the screw head, where the accommodation of the peri-implant soft tissue occurs. Meaning this is an area in which the sealing of the mucosa is going to take place. And it must be indicated for each area in our insertion. Palate is different because of a thicker mucosa. The buccal side, we can use shorter mini implant head, mini implant neck, transmucosal neck or transmucosal profile. And about the body as well, we have differences in the body of the mini implant depending on the brand that you're using, depending on the indication. We have mini implants that are very long. I use a mini implant, extra-alveolar mini implant here in Brazil from a Brazilian brand, which is 14 to 16 millimeters long, and with a transmucosal neck of up to 6 millimeters, because for some specific locations it is good. And about inserting the mini implants, of course, we're not going to go through this today because this is a short webinar, but we're going to have the opportunity to know more in our face-to-face course. Hope you go. Hope you stay with us. Hope you be with us in Romania for this course, okay? This is a Brazilian brand called Meireles. It's well-known overseas because Meireles nowadays, they sell for more than 80 countries, if I'm not mistaken, for more than 80 countries. And we have the tools needed to insert the mini implant here. Just a brief explanation. We're going to make first of all anesthesia, then we're going to probe in which height we're going to insert the mini implant. We're going to place a mark in the bone so we can guide our mini implant through that mark. And a special point, it's not a decorticalization like solid decorticalization. It's the beginning of the process. And in maxilla and mandible, we're going to be different. We're going to have different approaches for maxilla and mandible. And beforehand, we're going to plan for the right mini implant, the right head of the mini implant. For example, here, you can see that we have a shape that it doesn't allow for me to insert a wire. If I want to insert a wire for using loops, retracting loops, protraction loops, we need a place to insert the wire. So we need a mini implant head. And all of those variables are going to count when we have a solid biomechanical indication, biomechanical planning for the treatment, okay? So we have here the insertion in the upper arch with a specific inclination. We're going to explain that thoroughly in our face-to-face course. Now you have the decorticalization in the lower arch, which is important for us to have a better insertion of the mini implant. And now I want to show to you some different cases in which we focus on the correct diagnosis, correct biomechanical planning, and also the correct choose of the mini implant. So now we have a patient with a class 2 profile. We have this crowding in the upper arch, which is of course her chief complaint, and we also have anterior open bite. So this patient came to me this way. This is a transfer patient, and when I received her in my office, I asked for a new set of diagnostic tools like photos, x-rays, CBCT, everything that I need for planning better and more precisely for each case. And based on this, and based on her facial profile and my facial analysis, I can see we have some things that we need to consider. One thing that I need to consider is, during the correction of the open bite, can I allow for anterior teeth to go down? You can see that I have already excessive exposure of gingiva during smile, and also we have the class 2 profile. What I want in this case, making a long story short, I want to rotate her mandible up and forward, meaning counterclockwise mandibular rotation, and I also want to prevent extrusion of upper anterior teeth. What I mean is, if I want to prevent extrusion of upper anterior teeth, I need to have a certain type of mechanics established for this type of correction. Also, I didn't want to extract premolar, and there's a reason for that. Yes, I could have the premolars extracted. This was one of the options for sure. But with my type of approach, with this type of biomechanics that I set for this space for the distalization of upper teeth, I could provide as well intrusion because I'm distalizing the entire upper arch altogether. So as you can see, because I place the line of action force below the center of resistance of the upper teeth dentition, I will generate a moment. And the moment of the force that I'm generating here is intruding upper posterior teeth because I don't want to extrude upper anterior teeth, which was going to be a side effect of this line of action. I need to provide another force in the anterior segment, meaning the planning for this patient is based on the diagnosis. The diagnosis is going to dictate the biomechanics, and the biomechanics, being well and structured, is going to control everything. In this case, the distalization to correct the class 2, intruding posterior teeth, and for not allowing anterior teeth to extrude, I also inserted 2 mini implants in anterior segment. And this is going to happen, we pray for. It's going to happen this way. We're going to distalize, and at the same time of distalization takes place, we have intrusion of upper posterior teeth, allowing the mandible to rotate up and forward. Good, huh? The problem is that when we do that, when we distalize upper teeth, we also need to count on that we are going to expect, the distalization, the retrusion of upper lip, which sometimes is not good. So everything we do in orthodontics has a price to pay, okay? In this case, the price to be paid was the retraction of upper lip, but patient knew that. The choice for not surgery, not a surgical case, was hers and her family's. So we accept that since we have another option, not the golden standard of the planning. The golden standard would be the surgical treatment. She didn't want, and we accept that. We need to tell our patient, this is our secondary treatment planning. It's not a prime, the main treatment planning, which would be the surgical approach. But we need to respect. If we do something, if we can have something to gain with our treatment, it's okay, we can do that. Another option to avoid that would be the intrusion of upper anterior and posterior segment together and allow for the counterclockwise mandibular rotation. Problem is the magnitude that we had of that case. So in that case, because of the magnitude of the problem, it would be very difficult for us to just by intrusion to have the auto rotation of the mandible, counterclockwise mandibular rotation that would allow for the correction of the class 2. The magnitude of the malocclusion was a full step class 2 in one side. Because of that, I prefer to use this approach of distalizing upper teeth together with intrusion. So what we are doing now is based on diagnosis and treatment planning. So this is possible? Yes, it is. We can rotate the mandible this way and correct the class 2 in some cases. Not in this type of case with this severe magnitude of the class 2. So can you imagine intruding here and also and distalize, because I need to distalize more than this. You see the lower arch is crooked. We have a crowding in the lower arch. We have this second premolar inwards, lingually displaced. So we need to open a little bit of the space with distalization of the lower molar, increasing the class 2, increasing the need of correction of the upper teeth to distalize upper teeth. So it was too big for us just to use the intrusion. Because of that, in this case, I first of all opened the space, distalized a little bit, and I started with the loop to control the movement of the canine going down. A high canine, if we apply just one line of action, free force to push it down, it will generate a moment that would put the crown more palatally and move the root lingually, labially, buccally, which would generate bone fenestration. So I wanted to, of course we want to avoid that. And when we use special loops with pre-activations for that, we can have a better approach, okay? This is what I'm doing here. And by doing that, I managed to control the position by applying the step geometry, which is a geometry that we're going to discuss thoroughly in our face-to-face course in Romania. We managed to correct the position of the canine with the torque, with the angulation, all together because of the use of the special loop, the box loop with special activations. It's not a special loop. Special are the activations, not the loop itself. So I did that, and we managed to control the position of the canine. And with time, we put the wire inside the slot, and we went on with the distalization of upper teeth. And at this moment, just to see before and after and how we're now, we started with our mechanics. Line of action of force below the center of resistance. Anterior teeth controlling the vertical displacement by using also elastic in anterior segment. And here comes the topic, here comes the detail about choosing the right head for the mini implant. In this case, because I wanted to control the movement by only attaching power chains or elastics or even coil springs, we don't need a mini implant with the head of a shape of a bracket. A bracket-shaped head mini implant. So in this case, only a position to attach the power chains and the coil springs. Here we have it. We can attach both power chains or coil springs. You see, I'm just using stainless steel ligature to really fix the power chain in position. And in anterior segment, the same approach. I didn't need wire going inside the mini implant head, so only that would be enough for controlling the vertical. We go on with the control of the vertical displacement of anterior teeth. Guys, I think you understand that, huh? Because I'm applying a line of action of force below the center of resistance, there is a tendency for the posterior teeth to intrude because of the moment of the force, and anterior teeth to extrude also because the moment of the force generated by the line of action of force below the center of resistance. Why not apply it above the center of resistance? If you do that, you're going to make the counter moment. I mean, the moment of the force would extrude posterior teeth. What would be terrible for this case? Would have been completely nonsense for this case. So I didn't want that to happen. What I did is extruding anterior teeth, so avoiding the extrusion of anterior teeth by using the bands here. Those are regular rubber bands. And now I'm distalizing, generate the moment of the force, tending to intrude posterior teeth and extrude anterior. I will not allow for anterior extrusion. That's why we have 2 more mini implants there, okay? And after a while, I just fix the anterior teeth, and then we have the distalization still taking place and correcting the vertical, at least enhancing the vertical, okay? Meaning the correction of the vertical. And now we have the finish after 2 years, a little bit less than 2 years. It was 23 months approximately, okay, of treatment in this case. And now, if I'm not mistaken, but for sure less than 2 years. And we see before and after, we have the class 1 being correct, the distalization took place, and also the intrusion. And don't take my word for that, just take a look at this. Take a look at the gingival display before and after. I know this patient is smiling more here than here, like more energetic smile in the first picture, but if you compare exactly what happened in the cephalometric x-ray, I'm going to show everything to you, I promise, in our face-to-face course, I can prove you that this is the best way to do this type of mechanics, with vertical control of anterior teeth and by doing the distalization using the correct line of action for making the right distalization. This is the key point here. And choosing the best mini implant head for that, and also the sites of implant, the insertion of the implant, they are extremely important and sensitive to the right behavior of the treatment and to the correct outcome. This is what I'm going to show to you step by step in Romania. So here it is, what we have before and after. A little bit of auto rotation of the mandible, counterclockwise mandibular rotation, okay? Not that much because the case, again, was surgical, okay? But in this case, because I wanted I wanted to intrude posterior and extrude and avoid anterior teeth extrusion. This little bit of extrusion of posterior allowed for this little counterclockwise mandibular rotation. And also, of course, we have limits for that. Second case, I want to show to you now another approach. And in this case, I wanted to distalize one side. And by distalizing one side, we know that depending on the line of action and depending on the biomechanics you're using, you can well generate a very bad side effect, which is a canting of upper occlusal plane. I don't want that to happen. So in this case, I prefer to use a two-couple system, a loop, a special loop for correcting this. First, vertical. We can do the distalization with all the vertical, yes we can, but I prefer to do this way. And there is a very solid reason for that. When I do this way, I prepare the arches to receive the distalization. And also, I will allow for the correct position of the maxillary occlusal plane and the mandibular occlusal plane, and after that, I can distalize with the correct force. Look, we are doing the intrusion, making the intrusion of upper anterior. At the same time, we're controlling the inclination of upper teeth, protruding it a little bit so we can distalize. So after a while, now I have to correct the class 2, and then I will insert my mini-implant for that. So you see here, the side effect of this type of mechanics is the distalization of the molar crown. As you can see, just using this, because of the moment of the force, we distalize the crown of the molar, and because of the rowboat effect, we distalize a little bit the molar itself, okay? And now we have a second approach, which is the sagittal correction. And now I will insert a mini-implant. And for this, again, depending on what I'm doing, what am I doing here? I'm intruding posterior, I'm inserting a mini-implant to retract posterior and anterior teeth together, okay? A tip for that, you extract the third molar right before retracting. Wait until you start the retraction to to extract the third molar. Why? We know about the remember, rapid acceleratory phenomenon that's going to take place after extraction, after surgery. We're going to have a window of 3 to 4 months of faster movement. And what would be the opposite? If I extracted very early in the beginning of the process, what would have happened? Posterior area where the molar was before, it will shrink, will have the volume decreasing in 6 months up to 50%. So what I want is to avoid that. What I do the extraction, I refer the patient for extraction the day I'm doing the retraction, okay? We don't wait, we do it right away. That's another tip for you. And again, what I'm doing, I'm using a mini-implant, extra alveolar mini-implant. I will show to you how to do that. The first approach, the second approach, the third approach, and then we are going to insert in the right position. What I'm doing here with the manual screwdriver and the motor is the same. I'm just showing to you both possibilities, and that is going to be another part of our course in Romania as well. So this is going to be an extra alveolar mini-implant allowing for the retraction without the mini-implant in the path of the roots. So I'm freeing the mini-implant from the path of the roots so I can have a better, a precise, a safe distalization of upper teeth. And look at the head of the mini-implant. This is a mini-implant from the HDC company, which is an Italian brand, and they have this self-ligating head mini-implant. Come on, self-ligating head mini-implant is talking directly to me, because I love to use loops directly attached to the mini-implant head. If I had this, well, it would help a lot. So this is what I have in this type of mini-implant head. We can switch, we can just rotate this part, the cap, and close the path of the entrance of the loop. So you can see here, we have the position, and I usually print the model so I can assess the right position of the loop and the moments of the force that I'm gonna generate, and I can do that beforehand. I can try to see the possibilities. So for me, this is the best way to do things, because when I go to the patient's mouth, I have everything set. I have the planning, I have the execution prior to the real world. So I think I can do that better this way. And I use the 3Ds, my scanner, and I print it with my printers, 3D printers. And look at this, I will start with a very light force like 100 grams maximum in the first 21 days. Then I switch to a heavier force. Then I can go to up to 400 or more than that. We don't need it to do that. We don't need 400 grams. But in this case, I start with 300 grams of distalization force, okay, with the compression of the loop. Again, this is not something that you can approach here, but I'm gonna show to you. Look at this, guys. The correction of the class 2 taking place, and in this case, because I wanted to increase the lower anterior face height, I also used, as you saw before, I also used provisional crowns with higher heights, higher positional crowns, and then we can have increase in the lower anterior face height. So now distalizing, okay, look at this, how beautiful it is, huh? The distalization, look at the loop opening, and opening again. Look at this beautiful loop opening. So now we have this. Beautiful, huh? This loop is one of my preferences. I love this loop. This is a pyramidal loop, or a delta loop, as you want to call it, with a helix in the center. So we can decrease the magnitude of force delivered per unit of activation, keeping the force in a very steady height, okay? Very constant level of force, which is very good and allows for the correction with the control of the inclination, okay? Because of the moment of the couple. The moment of the couple generated here in this part, which is a vertical tube, the cross tube, and we can apply a torque, a couple to it, and then we have the correction. So this is post-treatment, and then we have pre and post with the correction of the lower anterior face height, the torque of anterior teeth, the overbite, the overjet, the class 2, all together, okay? So this is a way to approach this type of mechanics. Let's move on to the third case, I'm sorry. We have now to open the space for this premolar. And what I mean by opening the space of this premolar is this patient came asking for aligners. they are doing that a lot lately, huh? You know that. But what I chose for him is, let's make a hybrid approach. Aligner for a while in one arch, and aligner in one arch, fixed appliance for a while, for a certain period of time in the opposite arch, and we can correct the difficult things. We need to choose the right battles in our careers. What are the right battles? We choose the right mechanics, the right device for the right malocclusion, for that specific malocclusion. And I know that for correcting fast the position of the molar and correcting the angulation, pay attention. Aligners are not efficient in correcting the angulation of the molar during the distalization. Is one point, but it's not the main point here. Since I knew that I would need to make a torque, and a very effective real torque, meaning the center of rotation of the movement being the crown, going with the root buccally, because you know that after opening the space here, just a detail of the space opening, I use this mini-implant, extra-alveolar mini-implant, thinking about what I would need of him. What I needed from this mini-implant was the distalization. Look at this. I'm using the distalization with the mini-implant being the source of the indirect force, for the direct force, and also providing indirect anchorage to anterior segment. So two things here now. Direct anchorage for distalization of the molar, and indirect anchorage with a steel ligature from the mini-implant to anterior segment to provide good anchorage and to avoid the mesialization of this unit here, because the force is being applied from the premolar to the molar, from the wire to the molar, okay? So I needed this indirect anchorage for a while. And after that, the force of distalization ceases, or at least drops, decreasing as well the moment of distalization, the moment of the force. And now we have the predominance of the moment of the couple, the moment of the cantilever mechanics applied by this TMA strip here. So now we'll have the correction of the angulation, which is very simple, not simple because the torque takes time, as you know, but simpler than using aligners to try to do this with a molar. Come on, you know that, you know better. And now we want to go buccal with the crown of the premolar. The problem is that when we apply the force at the level of the crown, we're generating a moment. and the crown is going buccal, but the root is going in the opposite direction. What we call uncontrolled tipping. What we need now to correct the torque. How do we do that? By using whatever you want. I don't use aligners for that, and there is a reason for that. I have a video to show exactly why it's not going to work, and based on solid biomechanics. But again, I knew beforehand, I knew that I would need that specific loop to correct the inclination of the crown of the premolar. Now I'm using this loop, as you can see, to correct the torque, the inclination, the third key of normal occlusion from Andrews. And now I'm correcting the inclination by torquing, and patient can switch to the aligner therapy now. After 6 months of fixed appliance, we could move to the aligner therapy, which is a hybrid approach. I did that with the fixed appliance because, trust me, you're not going to want to do that with aligners. And this is what happened from a buccal perspective, the inclination of the crown being corrected. And you see in the tail, the torque is there, and after a while, after correcting the torque, I managed to put in a higher position. Not only having the torque, but keeping it, but retaining it. You need to retain, because you know that this is something that's going to relapse if you don't keep it for a longer time. So this is after correcting and keeping as anchorage while patient was wearing aligners, and we're finishing the therapy before and after, and we also have the occlusal view. So you can see that the movement of the crown of the premolar was very good, but the movement of the root was of course not efficient when I apply the line of action of force at the center of the crown. What happens? We have the crown here, but the root is here. What I want? A torque. Now I'm applying the torque, and you see the difference. Take a look, before and after, and you see that we have this area now of the premolar is not anymore visual. So meaning I have a good torque control of this type of mechanics, okay? Let's move on. Let me show to you the last case that I want to show you during this webinar, which is the situation in which we need to retract upper anterior teeth. Let's think we have aligners. This is what our patient want. So we can split this treatment into two phases. One with the aligners, just to correct the inclination, or to correct the crowding, to fix the crowding, and after fixing the crowding and distalizing upper teeth, from whatever perspective you can distalize them, you can use aligners if you want, or use another strategy. I'm using aligners as a theoretical movement here. Now let's say you want to retract upper anterior teeth with control of inclination. I have overjet, but I don't have inclination, extreme inclination of upper anterior teeth. What are my options? First option would be using aligners and apply a torque with the aligners to control the movement of the crown during the retraction. Is it possible? What do you think? Is it possible to control this type of movement using aligners? And I tell you, no, it's not possible this way. Why? There is a biomechanical reason for that. Let's break it down step by step. Aligners are applying the force now to distalize the crowns, okay? Presumably, when I have 200 grams of force, and let's say the composition of vectors here will lead this 200 grams to the center of the crown, okay? Of course, it's not that simple, but let's say, for the sake of simplicity, this is the point. And I have 200 away from the center of resistance, approximately 10 millimeters. And I need now to apply a couple to counteract the moment of the force, which is going to be generated because the force is being applied away from the center of resistance, let's say 10 millimeters. And if I have 10 millimeters, I will of course need to compose this force with the moment, because it's away from the center of resistance, multiplying the magnitude of the force per the perpendicular distance from the line of action to the center of resistance. Line of action is an infinite entity, so I can't go to the point in which we can draw a perpendicular line from this center of resistance to the line of action. And 2,000 grams per millimeter is too much. Let's say now I need to apply 200 grams in each position, 10 millimeters away one from each other, which is better than in torque, when we think about the distance, only the distance, comparing to the distance between 2 points in the crown, inside the slot, okay, because they are very close one to each other, meaning this is going to generate, for having a good torque, I need a high force, because the torque or the couple, the magnitude of the couple is we achieve by multiplying one of the forces, they are the same, by the distance between them. Distance in the bracket is short. Distance here is bigger, meaning I need less force, which is good, but there is a problem now. The force that you are applying is in the same plane as the force of retraction, meaning these two forces are in the same direction, and they are forces that must be summed. I have now 200s plus 200s. 200 plus 200 is 400 grams, okay? If I'm doing this plus a force here, I need to sum those forces because they share the same direction and sense. In this case, I have more force to retract than the other force that was supposed to be here to control the torque. So being the same plane, we can't really apply a real torque, a real couple. The thing is, those two forces are going to generate a moment that is bigger than the other force in the tip of the incisor, in the palatal side, to counteract it. So we don't have a couple, okay? And what is the difference between this and a bracket? When we use a bracket, when we use fixed appliance, the line of action for retraction is horizontal, still horizontal, but the couple, because the moment of the couple is a free vector, the moment of the couple is vertical now. The moment of the couple that we are applying is now in another plane. It's not anymore in the horizontal plane, it's in the vertical plane. So we have two different moments being applied correctly. This is the difference between the distalizing with aligners, only aligners, and distalizing by using fixed appliance. I'm not here defending the fact that fixed appliances are superior to aligners. That's not the case. I know they are superior in some movements and aligners are better in other types of movements. I know that, you know that. And the problem is that we think it works, and we try to do that, and we lose inclination by doing that. And by losing inclination, we are going to have a contact between upper and lower teeth earlier in the mechanics, earlier than it was supposed to be, like later when we have the correction of the canine position in a sagittal class 1. So what we have the contact, we still don't have the correction. What do? We make the lower arch lots and lots of IPRs. We perform IPRs, sometimes severe IPRs, to control this, which is very bad for our patients. The IPRs, they come with a cost. I'm not talking about it now, but they come with a cost, especially a periodontal cost, okay? So that's the difference between the aligner therapy by doing that and using another strategy. During the course in Romania, I'm going to present to you a new patent firsthand that I'm producing to use with aligners and with fixed appliance. It's not here, this is the precursor, this is the first draft of this mechanics, but we call it PowerPod. It's similar to this one, but in a different aspect. It's easier to work, and I'm going to show you some protocols by using the PowerPod that are going to help you a lot in your daily practice. So we can retract in one turn with no more than three aligners with specific thickness to have this correction. You see, understanding biomechanics, applying the right concept of the TEDs, applying the line of action force, applying the right concept of the torques, we can do everything in orthodontics. And this is what this specific days in Romania, this is what we are going to talk about. How to emphasize the good mechanics and how to avoid bad mechanics by using old strategies, by understanding everything about biomechanics, okay? So don't miss out, and now I'm gonna explain to you what's going on. That's it for today about our orthodontic explanation. You've just seen how essential TEDs are. And what you've learned today can already help you out with your mechanics. You're going to apply that tomorrow if you want. But here's the truth. Truly mastering TEDs takes more than 1 hour. And because this is such an important topic, combining theory with hands-on experience is key to reaching the highest level of confidence and control in orthodontics. And that's what I mean when I want to show to you in this training with hands-on, with a different hands-on, I will show to you a different way to apply this 2-day course in your practice, and I'm pretty sure you're going to enjoy it a lot. That's exactly why I've prepared this 2 in-person training that takes place in Romania, where we'll go deeper and deeper into advanced biomechanics, fitting strategies, and yes, the most effective TED technique and protocols that you can use. And that's just part of what you'll find there. There's so much more waiting for you there. So let me briefly introduce these two hands-on trainings for you. This is the first one, the intensive course linking biomechanics to clinical excellence. This event takes place before the Simply Auto meeting on the 29th and the 30th of October, I'm sorry, at the Mercury Bucharest Unity Hotel. In this immersive 2 days training, you will discover the real forces behind the tooth movement. You master the vectors, the torques, and the force systems. You must know them. And finally bridge the gap between the biomechanics theory and the clinical excellence. This is my main goal here, to cut this long journey that you need to have, so you can bridge the biomechanical knowledge with the clinical practice. I want to bridge them very soon for you. So this is the first 2-day course, 2-day hands-on course, and here we have the table of content of these 2 days. We have the basic of biomechanics, the forces, the moments, and I'll link everything with the clinical use. Clinical use of the biomechanics is very simple if you understand the concept, okay? I don't want to show to you difficult things and then sell you facility, sell you shortcuts. I want you to understand the process, and then I'll give to you some shortcuts, and I'll tell you what works and what doesn't work, okay? So we have hands-on with the models, the printed models. We have the second day with more the sequence of leveling and aligning, and in this point I'm giving you many hints and ways to treat your patient faster based on this specific moment of our biomechanics, leveling and aligning. And then we go on the auxiliary loops to retract, auxiliary loops to give torque, hands-on again, so hands-on practice, printed models, and also we're going to integrate everything. So the diagnosis, treatment planning, and biomechanics in the last day, okay? And now let's talk about the second course, the Orthodontic Finishing Lab, that will take place on November the 2nd and the 3rd, also at the Mercury Bucharest Unity. Mercury Bucharest, yeah, let me just take it. Yeah, that's it. This is where you master the art of and science of orthodontic finish, learning to diagnose, to plan and apply refined biomechanics for stable, static, and truly predictable results. This is the whole thing about it. Now let's take a look, let's walk through this finishing lab program. We're going to the fundamentals of biomechanics, two-couple system that we are going to use, we need to use to hybrid approach. Why hybrid treatments? Where clear aligners are not efficient? What are the clear aligners friendly therapy and the fixed appliance friendly therapy? And we go to the fundamentals of mini-implants and hands-on. Insertion of mini-implants, and we're going to use this, know how to use the CBCT to have a more predictable insertion of the mini-implants. Second day, loops and auxiliary loops for hybrid, for both hybrid and fixed approach. Loops for individual torque, loops for angulation correction, for rotation correction, molar uprighting. We're going to the hands-on with the loops and TEDs, and then we are going to learn very effective strategies to fasten up treatments with the loops and TEDs in orthodontics, okay? So, beyond that, and there's something that makes this training even more special. Both courses, they are going to be officially certified by the American Dental Association. You know the ADA, American Dental Association. You know that they have a very high standard, one of the most respected dental organizations in the world. This recognition means that every participant will receive an internationally valued certificate of participation, adding real credibility and prestige to your professional life, professional career. By joining this other certified things, you will be part of a global standard of excellence in orthodontics, in advanced orthodontics, boosting not only your knowledge, but also your career opportunities. You know that it means a lot. Huh? And beyond that, beyond the other certification, I'm proud to share that these courses are also officially recognized by AREO, the Romanian Association for Excellence in Orthodontics. And this is a highly respected institution, not only in Romania, but also across Europe and beyond. And having the recognition adds strong academic and professional value to our certification, to your credentials, okay? So this is one thing that I'm gonna give you as well. About our venue for both trainings will be the Mercury Bucharest Unity, which is located right in heart of Bucharest. It combines comfort, convenience, and modern facilities. Everything we need for an immersive experience as this one that we're going to have there. And the best part is its location, just minutes away from the many places in Bucharest, for example, the Parliament House, Old Town, and many other city main attractions. Okay, this makes it the perfect setting for not only for our educational program, but also for enjoying a little of a little bit of the Bucharest itself, one of the most beautiful cities in the world. The training will be hosted at the let me see it again, Mircea Voda Hall, in a modern and comfortable setting designed for this immersive learning. We only have 40 participants, by the way. 40 participants per turn. First turn, second turn, 40 participants. It's the maximum that I can handle. I know that because I did that before with all the videos, all the models, and the stuff that I'm gonna give to you, so you can go step by step with me. It's the maximum that can make this experience really comfortable. Okay, this hall is equipped with advanced technology resources that will enhance our training and make this entire experience even more impactful. The time my group showed me this place, I told them this is the one. This is the place I want to be. Each course will include welcome coffee, delicious lunch, coffee breaks, and also a personalized welcome kit, so you feel taken care of for the very first moment you step in the in this hotel. Because our goal is not only to provide knowledge and hands-on experience and hands-on practice, but also to make sure you enjoy a comfortable and welcoming environment throughout this entire experience. We chose this place for you, okay? I'm pretty sure it's going to help a lot this process. But take care. 73% of the spots are filled, so we have little spots available. And I need to alert you, I don't know if you know that, I don't know if you aware about it, but we're running a promotional price until September 20th. September 20th, meaning a few days ahead. That's why the remaining seats are filling up very quickly. And they may even sell out before the date. So if you really want to secure a spot in Bucharest, this is your time. Don't wait. And let me show you the prices now. Each of the 2 days hands-on course with all the practical training, real-world cases, the entire process, and also the international certificates is valued at 1,307 euros. Okay, honestly, I can tell you, for the level of transformation and learning you're going to receive, it's an incredible investment in your career. Make sure you can do that. It's going to be a very good opportunity. But because I want to make it possible for as many committed orthodontists as possible to participate in this event, we've opened a promotional batch only for those who are going to act quickly. If you secure a spot by September 20th, you'll pay only 1,057 euros per course. That's over 250 euros in savings for each training. It's a lot. Believe me, it's a lot. And to make this opportunity even better, if you're ready to take your expertise to the next level and participate in both trainings, we've created an exclusive combo option. When you enroll in both events, you unlock an additional 20% off. So instead of 2,614 euros, you pay just 1,691 euros for the entire experience, the complete experience. This is truly the best choice for those who want to deeper learning journey, to dive into this journey and save money to enroll as fast as possible, okay? You can also choose to split payments into 3 installments. So this is something that my group is giving to you as an opportunity, so you can really go deep into this, okay? Secure spots is very simple. Secure spots is very simple. You just need to do that. You just need to hold your camera and focus here. So click the links to register with all there you're going to have all the information. But if you want guidance about it, you can call my team. They are going to help you, okay? You can also, I think we have somewhere here, we have a link. Yeah, I think we do. Yes, my supporting team just put a link here in our chat, so you can go directly and you can chat with them. So take advantage of this to have all your doubts answered, okay? Now, I know that joining an in-person training often raises practical concerns, especially about travel, accommodation, where to stay, how to get there, and where the city, whether the city is truly worth a visit. But come on, this is Bucharest, this is Romania. That's why I want to make everything as simple and accessible as possible for you. Let me help you feel confident that Bucharest makes this an easy decision. Bucharest is one of the most beautiful cities that we have in Europe. Our venue, the Mercury Bucharest Unity, is located at this Mircea Voda 28, right in the heart of the city. Beyond Mercury, you also find several other excellent hotels nearby, and there are plenty of Airbnb options for those who prefer a more private stay. Whatever your preference, comfortable and convenient accommodations is just steps away from where we are. Traveling for Bucharest. How about traveling for Bucharest? Traveling to Bucharest is also very accessible. The city is like a hub for low-cost flights with connection from, I think it's more than 100 cities. Yes, more than 100 cities in 40 different countries across Europe, North Africa, and Middle East. So you have more than 100 different countries that can be linked to Bucharest, operated by over 40 different airlines. The main airport is Henry Coandă, that has direct flights from most European capitals and many major cities, often for less than 100 euros round trip, if you book in advance, of course. Once you land, it's a very quick transfer from the city center to our venue, from the airport to our venue in city center. Bucharest is also an amazing city to explore. And the best part is that many of its top attractions are located less than 4 kilometers from our venue, or 2.5 miles if you want to, if you use this measure. You can visit this palace here, the iconic Palace of Parliament, Romanian Athenaeum, and also the National Museum of Art. All of them very close to our venue. So you can go by walk, a simple walk, and also from our place to Old Town, Lipscani, cafes, bars, and restaurants in the historic center. Also the Romanian Patriarchal Cathedral and the Carol Park. I always go to these places when I travel to give courses or travel to attend courses or congresses. I love the atmosphere of the cathedrals, also the mosques. I love being there. This is powerful. So let me see if I have many. Yes, in short, Bucharest is a city full of history, culture, and beauty, making your trip not just educational, but truly unforgettable. This is true. This is really true, okay? And also, we are going to participate. I'm going to give a 1-hour lecture in our Simply Ortho meeting. Simply Ortho, let me tell you about it. It's one of the best congresses that you can attend. Not only because of the good speakers, because of those good speakers that are going to be there, and I'm honored to be among them, but also for the atmosphere. The atmosphere in the Simply Ortho events, it's amazing. You know, it's like the camaraderie, the people gathering together in the parties everywhere. So this is a good opportunity for you to not only go to a very high level meeting, but also to participate in this beautiful group, which is the Simply Ortho. It becomes a family. You know, we are always there sharing experience, the Simply Ortho group. And after that, after the Congress, and also between the Congresses, we are always together. And guys, I'd like to take a moment to give a special thanks to our sponsors, the Morpheus and the Secret Clear Alignment System, the 3D Dental Tech, and also the Nemotech. You're going to see all of them in my lecture, because they're not here only because they are going to sponsor us, but they're here because I believe a lot in their stuff. You know, I use a lot the Morpheus to the 3D analysis. I use Nemotech for my planning, the Secret Clear Alignment. I got to know that's one of the best. And the 3D is also there. with my scanning. So I really appreciate a lot their sponsorship, yes, but more than that, this good relationship that we developed with time, and we are now working together for a long time. Guys, so that's it. Don't miss this unique opportunity. Spots are strictly limited, and with so many international orthodontists already interested, we expect them to fill up very fast. So click the link in the chat now to secure a spot. Be part of this exclusive experience in Bucharest, guys. This is your chance to transform your clinical results and elevate your orthodontic practice to a whole new level. Don't just hear about it from people who went to the Congress. Be there with us in Bucharest. See you there. Bye bye.